Download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues. I'm Roshnita. Let's look at today's daily bulletin. India recorded more than 3,000 COVID cases for the second consecutive day on Friday, with 3,095 people testing positive for the infection in the last 24 hours. The positivity rate percentage of samples testing positive from those tested was recorded at 2.6%. The strike of Rajasthan doctors protesting against the Right to Health Bill has now seen the intervention of the State Medical Council as well as the State Human Rights Commission, with the Rajasthan Medical Council now writing to the various universities and medical colleges to provide details of the striking doctors. In this regard, Dr. Manish Sharma, the registrar of the Rajasthan Medical Council, recently wrote to the principal and administrators of attached hospitals, including Jaipur-based Sawai Man Singh Medical College and RUHS College of Medical Science, and all the government medical colleges under Raj MES. The council has further been asked to submit a factual report before the commission on 10th of April for the purpose of assessment by the State Human Rights Commission. In order to comply with this, the council has directed the heads of the medical college and hospitals across the state to provide the names, date of birth and council registration number of striking doctors at medical colleges and hospitals within 3 days to the council's email address. The letter further directed the medical colleges to ensure that the details are provided so that appropriate action can be taken under law against the striking doctors. Issuing a warning to the management of Punjab Institute of Medical Sciences, the state government has asked it to deposit the pending concessionaire fare or vacate the college. The notice to the college management in this regard has been served by the Additional Chief Secretary of Medical Education and Research. For the last 9 months, the matter has been pending and the college management already owes around Rs 70 crore to the government. Doctors' team of Jerbai Wadia Hospital for Children successfully removed a 100-gram hairball from the stomach of a 10-year-old girl who used to pull her hair and eat it. The girl was known to have trichophagesis, compulsive eating of her hair linked to hair pulling, leading to intense stomach pain. The patient is doing well after the 2-hour surgery. The patient, while touching her stomach, felt the presence of a hard mass and reported this to her mother. Her mother was alarmed and rushed her to Wadia Hospital for further treatment. The first case of a potentially deadly fungal infection caused by plants was discovered in a man from Kolkata. The 61-year-old, a plant mycologist, complained of a recurring cough, hoarseness of voice, difficulty in swallowing, a sore throat and fatigue for 3 months. He had no history of diabetes, HIV, renal disease, any chronic disease or trauma. The man, who was not named, had been working with decaying material, mushrooms and various plant fungi for a long time as part of his research activities, said doctors in the journal Medical Mycology case reports. Doctors performed an X-ray and CT scans on the man. The X-ray on the chest came back normal, but the CT scan results showed a paratracheal abscess in his neck. Paratracheal abscesses can block airway and lead to life-threatening infections, which can be deadly if not caught and treated quickly. Doctors removed the pus and sent a sample for testing to the WHO Collaborating Center for Reference Research on Fungi of Medical Importance, where he was diagnosed with Chondrostridium purpureum.
A new combination drug treatment showed promising results in patients with pan-refractory, recurrent or metastatic head and neck cancer, according to a study published recently in the Journal of Clinical Oncology. Head and neck cancer is a deadly form of cancer that arises in the lining of the mouth and throat. Worldwide, more than 7 lakh people were diagnosed with head and neck cancer in 2021. The disease is caused by the human papilloma virus or HPV or environmental carcinogens, including the regular use of tobacco or alcohol. When the cancer comes back after curative treatment, patients have an overall survival of less than 2 years. Investigators from the Smith Heart Institute at Cedar Sinai have discovered that patients who have round hearts shaped like baseballs are more likely to develop future heart failure and atrial fibrillation than patients who have longer hearts shaped like the traditional Valentine heart. Their findings use deep learning and advanced imaging analysis to study the genetics of heart structure. Their results were telling. We found that individuals with spherical hearts were 31% more likely to develop atrial fibrillation and 24% more likely to develop cardiomyopathy, a type of heart muscle disease, said David Oyang, who is an MD, a cardiologist in the Smith Heart Institute and a researcher in the Division of Artificial Intelligence in Medicine. Children born to mothers who had COVID-19 during pregnancy may be more likely to develop obesity, according to a new study published in the Endocrine Society's Journal of Clinical Endocrinology and Metabolism. More than 100 million COVID-19 cases have been reported in the US since 2019, and there is limited information on the long-term health effects of the infection. Pregnant women make up 9% of reproductive aged women with COVID-19, and millions of babies will be exposed to maternal infection during fetal development over the next 5 years. A team led by Von Andel Institute and Max Planck Institute of Immunobiology and Epigenetic Scientists has identified two distinct subtypes of insulin-producing beta cells, each with crucial characteristics that may be leveraged to better understand and treat type 1 and type 2 diabetes. In type 1 diabetes, beta cells are attacked by the body's own immune system, rendering them unable to produce insulin. Type 2 diabetes arises from insulin resistance. The resulting excess blood sugar from a person's diet causes beta cells in the pancreas to work overtime. Eventually, beta cells can no longer keep up and blood sugar concentrations can rise to dangerously high levels. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.